Good day everyone. In this video, we are going to introduce some of the abnormal mobility of the tongue. So in this session, we're going to talk about some such as tongue flexidity, stiffness, trembling or deviation, or shortness of the tongue. The normal tongue, as we introduced before, a normal tongue, in a healthy person, is supposed to be flexible and the movement should be voluntary, and also the color will be light red and film coating. In other words, if the patient presents with abnormal movements, such as some involuntary movements, especially the extend and retract movements, if presents as abnormal, you can see the 脏腑 organs, the situation of the 脏腑 organs from the tongue. So the first one is the flexed tongue. The flexed tongue is a soft tongue without strength to extend, curl or turn freely. So in this situation, the patient, when they put the tongue out, it's not flexible. So this is a image of flaccid tongue. As you can see, when the patient put the tongue out, this tongue was actually a combination. We're going to talk about this tongue again in the next few slides. This is an example of flaccid tongue. When the patient put the tongue out, it becomes very soft, especially this part. So this part soft and it don't extend well. In this situation, indicates insufficiency or deficiency of qi and blood. So it can imply deficiency. The reason why in this situation it is deficiency, this is very similar to this these two flowers. Insufficiency is the body fluid or the body fluid or the water reduced in the body. So such as the flower on the left side, it withered. While it withered, the shape becomes smaller. The leaves become soft. So that's what happened to the tongue. The tongue becomes smaller, becomes soft, and the tongue could not be extended out the mouth. And also begin to talk about this image again in deviated tongue. This tongue is flaccid and also deviated. As you can see, it moved to one side. Deviated is also similar because we didn't have the pictures in the next slides. So we're going to talk here why the patient will have the deviated tongue, which means, in other words, why the tongue moved to one side, same as this picture. It's supposed to extend on both sides evenly. That's our normal tongue. But why now the tongue changed to this direction? That's very similar. You can imagine these two images. These two flowers, one is shrinking, one still normal. So the muscle on the right side is still normal. Here it's weaker. So you can imagine it's like elastic band. You use two elastic band to pull. So you use two elastic band, to pull one stuff. If the force from the elastic band are the same, then you can pull the stuff equally towards you. But if number one is weaker, number two is stronger, you're going to pull to this side, right? That's what happens here. When it is extends on these both sides of the tongue, here on the left side is weaker. So the tongue on the right side push towards the left. So the left side push towards the right side. So that's the deviated tongue. The flaccid tongue, the indications insufficiency or deficiency of qi and blood. Stiff tongue or stiffness. It is hard, rigid, and unable to turn or curl. This is just indicates that the tongue is not flexible. The reason for this is the heat entering the pericardium or the heart. The stiff tongue also can present with the enlarged, especially for swollen tongue. So the swollen tongue, the patient cannot retract. That's also considered as stiff tongue. Deviated tongue. Deviated tongue, that's the explanation we have introduced just now. You can deviate it to either side of the face, can be on the left or right. It can indicate the liver wind, carry phlegm or phlegm stasis, obstructing the meridian. This is warning signs of wind stroke. The wind stroke, it is also the stroke. This deviated tongue mostly can happen in patients with stroke. So after stroke, some patients can present with this kind of tongue. When they put the tongue out, you can see the tongue move to one side. Trembling tongue. The trembling tongue, firstly, the uncontrollable involuntary trembling. So that's the image. That's the tongue trembling. The tongue trembling, what's the cause? Before we go to the details, the first impression when you see this tongue, you need to have that kind of thinking that something is moving. Something is moving here. What's moving is the wind. So trembling is the wind. Then you're going to think about the causes of the internal wind. What's the cause of the internal wind? Then you can refer to the 5 internal evils. The first one, internal wind. It can be insufficiency. If insufficiency, the patient will present with a red tongue, the red color, with trembling, with less coating. Okay. If the wind is due to liver fire, extreme heat, also can have the wind. In this situation, the tongue color will be red. The coating may be thick yellow coating. So that's how to combine the other knowledge in this session for our diagnosis. The protruding and waggling tongue. The protruding tongue refers to a tongue that is extended out of the mouth but not retracted back for a long period. This image, although it is described as protruded, the tongue protruded, but it is not the protruding tongue that we mentioned here. The protruding tongue, as you can see from the statement, the tongue is extended, but it's not trembling. If the tongue is trembling, if you go to the previous slide, it's trembling tongue. So the tongue protruded, which means the tongue extended out of the mouth, but cannot be retracted back. So when you see this image, you need to be careful that the description and the image is not matching. But here, just give you an example. What's a protruding tongue? A protruding tongue is the tongue is extended without trembling. A waggling tongue refers to a tongue that is extended and quickly retracted back. We don't have an image of this kind of tongue. This kind of tongue, the patient can extend the tongue, but retract it very quick back to the mouth. This is most of the time is in a severe condition, especially the pathogens affect the heart and spleen. The short-term tongue. The short-term tongue. This image we have introduced before. A short-term tongue refers to contracted, unable to extend after the mouth. So this is also not a very good image of a short-term tongue. The short-term tongue may be on both sides. So the patient cannot extend the tongue well, because for this patient, on the left side of the patient, the tongue still can be extended well, but you can imagine that if the tongue on both sides presents like this part, then we call it a short-term tongue. A short-term tongue can be severe condition as well, especially for the deficiency of qi, blood, or the spleen deficiency. So a shortened tongue is often a critical sign. So these are some of the common mobilities of the tongue. We're going to introduce about the sublingual veins as well. The sublingual veins refers to the veins underneath the tongue. So these two veins, most of the time, the vein will not exceed 2/3 of the distance from the sublingual caruncle to the top tip. The color is light purple and do not have branches. So there's only one, you don't see the branches from the vein. And also there's no static spots. This is special in our normal practice, our very common practice we don't really use or we don't observe a lot. But the vein here mostly in lung disease or for epidemic diseases due to heat, due to toxic heat, or in the other words they translate as febrile diseases. So in that situation, we will observe the sublingual veins. If the sublingual veins become shorter than it's supposed to, such as this one, shorter, and also you can see the spots under the tongue. So it can refer to blood stasis. It also will depend on the color what you will see. Use this image as an example. We will see that this vein, the color is bluish, it's shorter, and there's some spots. So in this patient, it might be the heat. It might be the heat, and the heat also accompanied with this blood stasis. There also the branches and also the color. So we're going to observe the distribution, the colors of at the bottom of the tongue, and also the colors of the vein. How to analyze the colors, also similar to the colors from the facial complexion or the colors we discussed in the previous videos. The purple, the bluish, the red or light red, that's the indications from the sublingual veins. These are the information on the tongue mobility. Until now, we have introduced all information on the inspection of the tongue body, and now we're going to study the tongue coating, the inspection of the tongue coating. The observation of the tongue coating, we're going to focus on the property and the colors of the coating, such as the thickness, the moistness, greasiness, or peeled off. So we're going to introduce one by one. Before we go through the details of the tongue coating, here are just two images of the tongue coating showing you what's the thin and thick tongue coating. We have the definitions of the thin and thick tongue coating in the next slides. The coating is the stuff on top of the tongue. That's something we're going to observe. And this one is quite clear, and thin coating, the normal coating. So what kinds of situations that we can see in the environment can contribute to our understanding? So a normal coating, a thin white coating, it should be very similar to this grass. When you see the image in the middle, we want the garden have grasses, but not too much. So we don't like this kind of grasses. We don't like this kind of grasses. We don't like the overgrowth of the grasses. And then again, in terms of the grasses, what do we need to maintain this kinds of grasses? What do we need to maintain your garden well? So firstly, where does the grass grow? That's the soil. It must grow on the soil. We also need a sun in the environment. We need to water the garden, right? We also need a fertilizer. That's what we put in winter or early spring to maintain your garden. So these four aspects are the aspects that we need in the environment to maintain the grasses. If the grass overgrows, then we can think that it might be too much fertilizer, or you water too well, you water too much, so the grass can grow very well, or the sun is very strong, and the soil is still good with fertilizer. And on the other hand, what happens if the grass doesn't grow well, or the grass becomes yellow, or even the grass is dying? There's no grass there's no grass in the garden. So you're also going to think from these few aspects. That's what a farmer or a gardener will think about. If the grass doesn't grow well, do we water well? We need to put a fertilizer. Is it the weather? There's no sun at all, like in winter. The grass doesn't grow, and if you don't water, the grass becomes yellow. And also the soil. If the soil, the property of the soil is not good, the quality of the soil is not good, the grass also won't grow well. So now we go back to our coating. The coating is very similar to the grasses. In order to have this kind of coating, a thin white coating, a healthy coating, we need the sun, we need the soil, we need the water, we need the fertilizer. This is all we have in the body. What's the soil? The soil is the earth. That's the spleen and stomach qi. This also can see from 5 elements. The spleen and stomach is earth. The sun is yang qi, where the heat comes from. The water is the body fluid or influid. Fertilizer, that's the waste. The waste in terms of the dampness or phlegm or other waste. or the abnormal water distribution. It is a body fluid, but when it becomes abnormal, we also call them waste. Such as if the water metabolism, if the water move to the wrong area, we will cause dampness in the body, and this dampness is the waste. So now again, when you see the coating, all what you think, all what you need to think about is these four aspects. When you see this one's normal, when you see a thick coating, you need to think about what's wrong here. For instance, this patient, the coating is slightly thicker than the normal, so that's very similar to the grass overgrow. The grass overgrow, which means you have too much fertilizer or water, right? So from our body's condition, from the body aspects, what do you think about this term? The thick coating, too much fertilizer. It might be too much fertilizer. Where does the fertilizer come from? The waste. So this patient may have excess dampness or excess phlegm in the body. So that's the waste used as fertilizer. Does the sun grow well? Because in summer, the grass also grow easier. If you don't cut the grass, you will become overgrown. Does this patient have too much yang qi or too much heat in the body? The answer is not. The patient didn't have enough yang qi. The reason is because of the tongue. The color of the tongue is pale. The pale is the coldness. So that's the indications from the colors. So the coldness from this tongue. You also can see the teeth mark on the side, right? So firstly, the patient will have coldness. The coldness, lack of yang qi, lack of sun, will result into coldness and also result into dampness. That's the waste. The waste can be the dampness or the phlegm. That's why the patient will have thick coating. When you see the teeth mark here, you still remember in the previous videos we have introduced the teeth mark that can indicate the spleen dysfunction. So when you see this kind of tongue, you will see that the patient suffers from the coldness, internal coldness, have dampness or phlegm in the body. The pathogen also have already affect the organs, especially for the spleen function. That's why the teeth mark and also the dampness in the body also can reflect the dysfunction from the spleen. So that's how to inspect, how to observe the coating. So when you see the coating, think about these four aspects: the spleen, the earth, the sun, the water, and the fertilizer. Think about this and it will be much easier for you to remember and to understand the coating. So firstly, the thick or thin coating. A thin coating means that the tongue body can be seen underneath the coating. So in other words, that's a thin coating refers to we can see through the coating. We can see the tongue. We can see the muscle of the tongue through the coating. A thick coating means that the tongue body cannot be seen underneath the coating. So here, the first one is the top one picture is an example of thin coating. The bottom is an example of thick coating. We see through this coating. We still can see. We see through here. We still can see the coating. We still can see the muscles of the tongue. That's considered as a thin coating. the thick coating. As you can see, you cannot see the tongue. All what you see from here is the coating. You don't see the muscles of the tongue, so this is considered as a thick coating. And just one more word from here, this tongue, especially the tongue above. When you see the coating is not even, especially like this, you need to ask the patient, did they brush their tongue? So if from the brushes, it can have this kind of sign. It also can be abnormal situation. So you need to identify is normal or abnormal. The thick tongue indicates the pathogen and also the healthy qi. So when you see the coating, you think about the thin coating, you will think about the stomach qi. The thick coating, you think about the pathogens. The pathogens also can affect the internal organs. And the thick coating can be affected by the phlegm, can be affected by the food stagnation. These are all the fertilizer. Thin coating is a normal coating. So that's why we said a red tongue, a light red tongue with thin white coating. So such as the picture on top. This picture. This tongue is considered if here the coating still have the thin white coating, this tongue is considered as a healthy tongue, but especially on the sides. So sometimes it's a bit difficult to find a very healthy person. That's why we don't have many healthy tongue. Here are some other examples, images on the tongue. The first one is a girl with food stagnation. So you can see the thick coating, thick white coating. This one, also the thick coating at the tongue root, from the middle to the root. What happened to here is the spleen and stomach, and the root is the kidney, right? So in this patient, the treatment will be focused on the spleen and kidney. The tongue, the color of the tongue is pale, so it will be the yang deficiency of the spleen and kidney. You also can see the teeth mark on the side. That also indicates the spleen deficiency. So when you see this kind of tongue, you can conclude that the patient suffers from yang deficiency, accompanied with the dampness of phlegm and spleen and kidney yang deficiency. The image in the middle is an image of a red tongue. So you can see the red on the tip, redness on the tip and on the side. So this patient suffers from heat from the heart and the liver. And when you see the coating, also white coating, and at the roots, we can't see from the image, but here slightly thicker. So when we talk about the thick and thin, you also can think about how thick they are, like the thickness from this picture and this picture, and even this picture. They have different degrees of thickness. So that's something, the more you see, the more you observe, the more standards you will generate by yourself in your mind. Also from our lectures here, we provide you about more or less, I think slightly less than 100 images. So you need to identify all these different tongues. Try to firstly try to describe what's the manifestations, and then try to explain with the indications. Changing from a thin coating to a thick coating indicates the disease become worse due to pathogenic factors prevailing. Changing from thick to thin, it indicates become better. So this is very obvious because the normal tongue coating is a thin white coating. A thick coating is a sick condition. So from thin coating to a thick coating, which means the disease is developing. From a thick coating to a thin coating, you can see the disease is recovering. And from the inspection here, the tongue inspection, the inspection, including the tongue inspection, all what you need to do, try to observe, the more the better. So apart from the images here, you also can see from your families, from your friends, try to identify what's wrong with their tongue. So from this image, firstly the color, also pale, the tongue color is pale, the thick coating from the middle to the back. On the sides is not too bad, on the tip also not too bad, but the tongue color is pale. This one is evenly the coating, but the color also pale, so can indicate the cold condition of the especially the internal cold condition of the patient. We're going to stop here for this session, and then in the next video we are going to continue the discussion on the coating. Thank you for your attention.